if we underplay the effectiveness of vaccines within the context of a growing lobby of anti-vaxxers that will no doubt become more prominent once effective vaccines become available, because we'd really like people to then take up the vaccines. So I think now more than ever is the time to equip journalists with knowledge through trainings and webinars. And luckily, during the period of COVID, it's become easier to present trainings because we got used to webinars and digital training more than previously. And I think it's also a real good opportunity that's presented, because political and business journalists who may never have been interested in this type of science journalism training if there wasn't an epidemic will now be open to it. And an example is a training that Becky Sisa hosted in August and July for journalists in Africa on epidemiology. And of our 63 participants, 2/3 were not health journalists. They were political journalists, general journalists, and business journalists. And that the epidemiological knowledge will now stay with them beyond COVID-19, which is a long-term impact that because we took an opportunity during a time that journalists would be more open to this. In terms of what the COVID-19 media landscape would look like, I think the economic model of the media was broken long before COVID. COVID really just accelerated what was already there. We've seen considerable loss of income, and as a result, the closing down of publications and many, many job losses. Just here in South Africa alone, about 700 media professionals lost their jobs the past 6 months, and 2 large publications and 80 smaller publications closed down entirely. I think we are therefore going to see a rather fast increase in reader revenue models in the form of membership and the subscription models, and also combination funding models that rely on a combination of advertising, of reader revenue, and philanthropic support. I believe in terms of philanthropic support, donor-funded journalism is going to start to play an increasingly important role for 2 reasons. Firstly, it can provide cash-stripped mainstream media organizations with content for free now that they really don't have the money to appoint more reporters. But secondly, a point that relates to what Patricia was saying, it can provide them with specialist content. We don't have enough specialist reporters, and particularly science-based health content. And that's the type of content that is more expensive to produce than general news, because specialist skills normally come at a higher price than general skills. And a clear need for that was generated during COVID-19. I think we will also see more and more donor-funded media startups that will specialize in niche content, including more fact-checking and data journalism outlets within the context of so much misinformation that we're currently seeing. But this will come with a challenge, with a significant requirement for skills.
Wide-ranging discussion there on the media landscape post-COVID-19 hosted by the African Union Development